Darren Wijaya, MD, Loma Linda University Health, at the Mo Ask Spotlight 2025. In this interview, we focus on a real-world case study on metastatic non-small cell lung cancer, sharing insights on a median progression-free survival of 15.81 months and a median duration of response of 22.1 months, plus an objective response rate of 40% at 6 months with osimertinib treatment. These stats and much more coming up now.
Sure. Hi, my name is Darren Wijaya. I'm a third-year internal medicine resident at Loma Linda Medical Center. The project I'm presenting today is uncommon EGFR mutations in metastatic non-small cell lung cancer, and its response to EGFR inhibitors. This is a retrospective cohort study. So just a bit of background. EGFR mutations can be broken down into two subtypes, common versus uncommon mutations. Common mutations specifically include exon 19 insertion deletions, all of them, as well as exon 21 L5-8R, that specific mutation. There's pretty good data with regards to how these common EGFR mutations respond to TKIs. Important to note is osimertinib is the gold standard of treatment for intracranial metastases. However, uncommon mutations have a bit sparsity of data. At this point, based on the Lux lung trials, the only FDA on-label treatment is afatinib. Osimertinib has not yet been established in guidelines, hence the purpose of this study. So this single center retrospective cohort study included 10 patients, all with metastatic EGFR uncommon mutations, 5 of which had single uncommon mutations, the other 5 of which had compound mutations, at least one of which was an uncommon mutation. The outcomes of interest was time to response, duration of response, median progression-free survival, as well as objective response rate. What my study ultimately showed is that these patients ultimately responded relatively well to osimertinib, first-line osimertinib therapy. The median time to response in the overall cohort was 1.58 months. Median duration of response was 22.1, and median PFS was 15.81. Objective response rate was 40%, both at the 6-month and 12-month time points. And disease control rate, which I had forgotten to mention, was 100% at the 6-month time point and 70% at the 12-month time points. Intracranial response was also seen with a median TTR of 1.13, duration of response was 11.06, and median PFS was 14.73 months. Objective response rate and duration of response was pretty good as well. ORR was 40% at 6 months and 20% at 12 months. DCR was 100% at 6 months and 60% at 12 months. So this project is currently in the manuscript submission phase at this point, so stay tuned, for where it gets published. I think good research moving forward would be to do some sort of meta-analysis or even a prospective study on these uncommon mutations. I think kind of the best study we have right now is a unicorn study. It was a prospective trial, but it had a very small subset of patients that had these uncommon mutations. So it'd be good to, increase the N and get more power to the data.